Social Services Boardroom. Thursday evenings are a series of Haudenosaunee cultural teachings starting on January 21st and running until March 31st. These take place from 6 to 8 p.m. and it's open to all ages. Some of the topics they'll be addressing are identity, self-expression, our history, the Great Law, the Code, mental emotions, spirituality, relationships, physical health, and they'll be ending with a dinner and a social on March 31st. Child and Family Services will also be providing a series of workshops. There will be one on community updates and progress on the child welfare designation on January 14th, the role of the band reps on January 28th, Kids Have Stress Too in a parenting program on February 11th, Adults Have Stress Too on February 25th, Separations Anxiety on March 10th, FAS and FASD March 30th, Managing Difficult Behaviors on April 13th, and a presentation on family violence on April 27th. These programs will all run from 4:30 to 6:30 p.m. and for more information you can call Min or Eva at 519-445-4050. There are also volunteer services available for transportation, child care, primary prevention, resource development, and special events. So if you need some help in those areas, you can call 445-2950. I want to talk a bit about the medical clinic, as the community will have heard that Ancestral Voices, located in the plaza in Ohsweken, has announced that they will be opening a medical clinic. There have been many questions as to what type of services will be provided in this clinic, and Gail Whitlow, who is the owner, appeared in front of the Six Nations Council on January 26, and Council put a number of questions to her. They also agreed that she should come back in 1 month with her partner to answer all those questions. In the meantime, Council staff have been doing their own research, and Council has met with various professionals to discuss some concerns about this clinic. Ms. Whitlow is being invited back to Council on February 16th to make her presentation and to answer questions and concerns of Council. And this will be held at the open meeting of the General Council on that day. Public Health has asked us to make public the announcement that was made by the Public Health Agency of Canada, and it's with respect to what is called travel-related cases of the Zika virus. This originates from Central and South America, but they've asked us to say it because you never know if those diseases can travel. Right now, there have been no reported cases of locally acquired Zika virus infection in Canada to date, but we want to provide information so that people are prepared should it ever arrive here. Public health information has been posted by the Public Health Agency of Canada in response to confirmed travel-related cases of Zika. Since the 1950s, Zika infection in humans has been reported in Africa, Asia, and the Pacific. In 2015, outbreaks started to emerge in South America. Zika is a virus that is spread from infected persons to others by mosquitoes. The mosquitoes known to transmit the virus are not established in Canada and are not well suited to our climate currently. Approximately only 1 in 4 people infected with the Zika virus will develop symptoms. Zika virus disease is usually mild, and it has an incubation period of 3 to 12 days. Symptoms last generally a few days and can include, but are not limited to fever, muscle pain, joint pain, headache, physical weakness, lack of energy, rash, pain behind the eyes, and red eyes. There is no vaccine or medication that protects against the Zika virus infection. Treatment of Zika virus is aimed at symptom relief. Anyone who has recently traveled to affected regions and developed symptoms similar to Zika are advised to immediately contact their healthcare provider and inform them of their recent travel to a Zika-affected area. The risk for Canadians is to those who may be traveling to affected areas. Pregnant women or women planning on getting pregnant are the most at risk, and they are advised to discuss their travel plans with their healthcare provider and consider postponing travel to areas where the Zika virus is circulating. If travel cannot be postponed, strict precautions should be taken to prevent mosquito bites. It is suspected that Zika infection during pregnancy may have serious adverse effects on the developing fetus. When traveling to affected areas, travelers should take precautions to prevent mosquito bites. This can include, but is not limited to, using insect repellent, protective clothing, mosquito nets, screen doors, and windows. So we thank Public Health for Canada for giving us this information, and our own Public Health Department, who have asked us to put this out to the community. On the city boundary discussions, as I mentioned, the announcement was made last month that the city and the county have reached an agreement on the boundary discussions, and they have signed a memorandum of understanding. Although we were not involved in the actual discussions, officials from both the city and the county did give us verbal briefings on what they have agreed to, and they have said that they are going to deal with the elected council on this. We have now been contacted by the city, who wants to start doing consultation directly with Six Nations. So I'm working with Mayor Friel and Mayor Eddy, as the first step will be for both of them to come and meet with the elected council. It will be an open session, and we're just trying to finalize the dates. It will be towards the end of the month, maybe the end of February or early March, and I don't have the exact date, so you can just watch our website for the date that will take place.